happenings right now in Kansas City as the Cincinnati Bengals tied the game. It went to overtime and they intercepted Patrick Mahomes, the former MVP, on their first overtime possession. They're about 10 yards away, Chris, from making their first Super Bowl in over 30 years. I think our friend Dr. Hoa Nguyen at American Medical Center, he's a Saints fan, I believe, so I don't know if he's watching the game.
Yeah.
No.
Yep.
Not watching the game.
Sorry, Doc. Dr. Hoa Nguyen, he's a former chair of the Physician Advisory Group, fighting out of American Medical Center Clinic in Manila this morning. Doc, thank you so much for joining us. I don't even know where to start. So where do you want to start?
I agree. I don't know where to start. There's so much thing really crazy. But, let's start with the new guideline. I think that, my head spin when you talk about this morning. It's very confusing, but the bottom line is 2 or 3 things I want people to take out of the guideline. And I know it's not going to follow the guideline, but I think the guideline right now it need to be kind of revised again. Okay, so the number one thing is that if you test positive, you have to isolate yourself at home for 5 days at the time where you test positive. Not at the onset of symptom. I tell you, it's very dangerous when you start day one as the onset of symptom because most people have absolutely no idea when the symptoms start. For example, if you say a symptom start about 4 days ago, you test positive now. That means that you only isolate for 1 day and you're going to go back to work. Guys, that's very dangerous. So please, people and employer, if you test positive, you're going to count the time that you test positive as day 0 and count day 1 the next day and 5 days out. But do not go back to work if you think that your symptoms start 3-4 days ago because you're going to go back to work and infect everybody at work. So again, please, start your test date number 1 or then number 0 on the time that you test positive, not based on your symptom date. It's very dangerous. Like I say, we see that in the clinic, and people really don't know when their symptoms start. So for the most safest way is to count day 0 as the time where you test positive, and count 5 days out before you can return to work. If your symptom improve and you have no fever for 24 hours, and then you can wear your mask at work on day number 6. Okay, so that's very important, not on the time your symptom, because again, most of them don't know when the symptoms start and they're going to shortchange the isolation period and they're going to get the workplace infected. Okay, so that's very important on when do you start your day 1, okay?
Doc, can I ask you something?
Yes.
Because of how these guidance are changed frequently, when you were with the PAG, were these ran by the Physicians Advisory Group to kind of vet them and say, oh yeah, maybe you should change this or that before it's released? Or
yeah, I mean that's what we used to do. I'm not sure it's still there or not, but I think that we should not be changing the guidelines so frequently because there's nothing changed out there that recent. And the guideline, as I talked to Chris in late December, is pretty straightforward already. And guidelines should come out once and it should not be changed every week or so because there's nothing changed there. So again, the testing date for positive and when we go back to work is very important because I hear a lot of employers express the concern on the employee coming back to work, still coughing, congestion. So again, the safest way is basically, count the date, start the date when you turn positive, not on the date the symptom. I tell you, very dangerous to put that burden on the patient and the employer that have the risk of having the employee come back and still infected. Okay, so I just want to pass that on. But yes, the guideline I hope it will change for the last time. I hope the PAC will look at very careful before they push the guideline out. Okay. For close contact positive, yeah, vax or unvax to me is should be the same. You know, everyone should wear their mask at this point when they go to work or they go outside. But I would highly, highly encourage, symptomatic or not, you should be tested on day number 4 or number 5 post close contact that you have there. So, don't test any earlier than that. It won't do any good. If test negative doesn't mean anything. So the close contact testing should be number 4, or day number 4, number 5. But I would highly encourage people to get tested on that day and not be deterred on the shortage of test kit. That's not the people problem, but we should come out there and get tested to let you know if you have the virus or not. But again, it's on day 4 or day 5 post close contact, and not sooner than that. I would get tested if you have close contact to protect your family and protect yourself in your workplace. Okay.
As you know, and our listeners know, we still have the Adaloop still has this ban imposed on anybody coming on live on the link, and it's been in effect for several months now. But just in speaking with any of your friends, have you heard if any test kits have arrived? Because Friday we were told only 23,000 were left.
No, I know I know the test kit is going through the procurement process, and I wish that they treat it as emergency and not go through the procurement process, just because we need to test people out there, especially in the middle of the surge. There's no word when the test kit coming here. I know that it's going to be out in about a week or so, but we should that should not be deterrent on people go testing, because if not, this high triple-digit number is going to continue for a long time, and the hospitalization will continue to go up. Again, we going to be in this surge probably the next 4 to 5 weeks or so. So people need to kind of help curb the surge by really paying attention to symptoms, get tested, and try not to go to any gathering at this point.
Mm-hmm. Can you talk about BA2, this other Omicron variant? How concerned should we be right now?
Yeah, we should be concerned with BA2. I think that's what they call a stealth variants, right? So right now we still don't know much about it. I know it's in the UK and in Europe, and especially Denmark. But the word is that the test kit that we have right now might not pick up the BA2. So that's going to be interesting. You treat everyone by the symptom. But I hope that's not the thing. So I think we still have a lot of things that we learned about it. We just have to kind of watch out. But right now we need to handle the current Omicron variants first. If we don't do anything different, I tell you, a lot of people will turn positive. And again, we cannot forget about the risks of life loss in this variant. So we will lose more life on it. So we have to be careful on this one.
Right, you said if we don't do anything different, we're still going to get the same results. So, is there anything different that we can do?
Yeah, we should put some restrictions on gathering. Sabrina, Chris, everyone know I passed by Paseo last night and I saw, oh my goodness, I don't know what's going on there, but it's so full of cars and tents, everything there, that I don't know. This is the way that we're going to treat, this Omicron like a mild flu or whatever, and we let it run rampant. It's going to hurt our economy, going to hurt our people, and to me, restrictions should put out there for people to follow, and people will follow. But if you put the message that's a mild flu symptom, it's not going to work. Again, as you can see, Dr. Lombard the other day, if you trust that we're going to build herd immunity to this Omicron, you really read the wrong message. There's no such thing as herd immunity on this COVID. It's going to keep coming back, and we're going to hurt our island much, much more by not putting any restriction out there.
But Doc, I mean, the governor said prepare for a super typhoon, and then we didn't do anything, and now here we are.
I know.
I mean, it's crazy.
That's where it's a mixed message that is really need to be sent out correctly. But yeah, it's not mild symptom, guys. If you see people that come down with, including some of my staff, they can't breathe. It's not mild. And it's not like the flu symptom. We typically don't see people that many admit to the hospital for flu, and we don't see the flu this infectious. It is very infectious. So we cannot treat this a mild symptom. Again, if you think it's a mild symptom, then to me, we should not be in any pandemic emergency, because it's like the flu. So the message has to go out there very clear. And if we're going to be in a pandemic emergency, then this is not the flu. This is not mild. We will have to pay attention to it. And again, the message had to be out there appropriately, so our people can take caution on it and not curve the surge here.
Yeah, Doc. I mean, I totally agree with you. But when GDOE's dashboard, this is what they told the parents to pay attention to. It's high risk. They're in a high risk status right now, but everyone's still going to school. We had the governor say prepare for a super typhoon. Well, she's over in Washington D.C. at the National Governors Association. What do they have, like a meeting in the winter, in the spring, the summer, fall, and then in between? Because we're just here. So I know what you're saying, that the message has to be serious, but when you look at the government's response to it, outside of we're running short on test kits, I'm not sure if that seriousness is something that the people are getting from that message.
Yeah. I think that's where the media coming from. So we just had to push a message out there for people that hey, take it serious. And like I said, it's you don't want to bring this home to your elderly people at home, especially people that have comorbidity. And you can see that we lose some young people too in the 40s, not just the old one. Yeah. So you got to be one. And Chris talked about GDOE. I know there's a lot of positive out there in the student. Yes, there's a spread out there in the school. When you see students that turn positive in the household and the parents are negative, and we see multiple, there's a spread in school. So the school do its best to kind of prevent the spread in the school, but I don't know who do the contact tracing in school, the GDOE or public health. But we shouldn't say that there's no spread in the school unless it confirmed there's a spread in school. And I just ask the parents that if you are positive as a parent, please let the school know and keep your kids home from school for at least 5 days to make sure you monitor the symptom. And if your kid have any type of congestion or runny nose, do not send them to school. Go get tested first. Because yes, there's a spread in the school. I would tell you 100%. But again, there's no confirmation if you don't look for it. But from the clinic standpoint of view, we test multiple students that turn positive and the parents are negative. That means that it's within the school. So ask the parent to keep an eye. Again, if the parents are positive, keep your kid home from school for at least 5 days, monitor the symptom, and get tested before sent back to school. If your kid children have any symptom of runny nose, just test them before you send them to school.
Mm-hmm.
Doc, we did have a comment here. Sorry, just real quick. Would you be able to explain, because this was on the JIC, what is unknown underlying conditions on a COVID death of this 45-year-old vaccinated, a male. That was what we got in the JIC. Is that something where they just look at it and they're like, oh, there must have been something wrong with this guy? Or what does that even mean, Doc, that it makes it on a document that goes out to the public?
If anyone that passed away DOA that hit the emergency room, they will test for COVID. And some people have comorbidity on it, and you got to remember, COVID is not just purely a viral infection affecting the lung. It's very special. It's different than influenza or anything else. Is that it creates a lot of inflammation that affect the brain, the heart, the lung. So people that have any type of comorbidity, like high blood pressure or diabetes or cholesterol, it can exacerbate their comorbidity and make them have a stroke or a heart attack. That's the bad part about the COVID, is that it creates this inflammation and this microembolism that causes this problem. Influenza doesn't do that. Yes, it's not the sole source of the reason that people die, but it does exacerbate the comorbidity and cause them to die much earlier than they're supposed to. And that's what people understand, is that, yes, they're going to count COVID death as you come in for different reasons, like, heart attack or stroke, just because, COVID does exacerbate by create inflammation and microembolism on those people. And again, if they don't have the virus, they might survive, but they might not be the time that they die yet, just because they won't create those inflammation and microembolism that throw him overboard. So, yes, it's a fact that you have to look for, even if you come in with other reason and then you test positive COVID, because you have to know, is that the chance to exacerbate the comorbidity or not.
Doc, what are you hearing about, like, burnout of public health employees, frontliners? This has been going on. We've been going at this for how long, Chris? Two?
Yeah,
years?
Yeah, it's been a while.
Yeah, you're talking about how it affect the front line of the healthcare?
Yeah, burnout. Like, they got to be really restless, especially with Omicron.
Yeah, I mean, the clinic again, tired. I'm not talking about just AMC. All the T2 clinic, we get hit hard. It's very hard to keep the same pace of seeing sick patient when your own staff turn positive too, and affect all the clinic. So just like today, we probably run half capacity just because it does affect the people inside the clinic. I imagine the hospital, I know they have lots of positive in the hospital in the employee, and that affected their care for their patient too. So, it's when you have open the floodgate and let it happen, it will affect every aspect of society, even to the healthcare, the restaurant, other business. Yeah, it's going to hit them. But again, when the frontliner, like the clinic, and then the last point is the hospital get affected because they have infection and their staff, you're going to affect the access to care for the people, especially in this time when the surge are going on right now. So, it's very hard. I wish that the administrator kind of look at things in a different way, but it does. You get tired, and people are stressed to the max on the healthcare system wise. The front line, I'm sure the police and the fire department the same way.
By the way, I have been gone for a while, but are we still doing the vaxxed, unvaxxed, you go eat outside?
Yeah.
Is that still in
We
effect?
still do the vax, unvax, and really, again, time to take a very hard look at it and make some change. I don't think that we should be, make the different vax, unvax. Everyone carries the virus. So I think that should be we look at very carefully and change it. So that's the part where I listened to you guys talk this morning about mandating the testing for unvaxxed person, and I know that the private employer have to bear the burden, the cost, and that makes no sense. I think that the GovWam unvaxxed and the private employer unvaxxed should be tested for free. The testing comes from your taxpayer money. So I think that to distinguish between the private employer that had to pay and the GovWam employee that don't have to pay, it makes no sense. It comes from your tax money. So they should be treated the same. So the private employer should not spend anything on the mandate for them to be testing the unvaxxed people.
All right, Doc.
I'm sorry.
I guess
Doc,
for
we
me,
did-
go ahead.
I'm sorry, we had a question here. I know the guidance says high risk over 50, unvaccinated or partially vaxxed with at least one or more comorbidity. It's confusing. Does this mean that you must have one or more, or just one if you're unvaccinated?
Yeah, if you unvaxxed or vaxxed, if you have one comorbidity, you qualify already. And it's not one, right? Most of us, including myself, are overweight. So that's already is a qualification already. So, so if you show up in the testing line, they'll just say, I'm overweight. So who's going to argue with you? You're going to be tested anyway, right? Because that's one of the criteria of the risk factor for comorbidity.
Thanks, Doc.
Yeah, I guess my final ask of you is, it's been triple digit positive cases since the beginning of January. So that means thousands of people have tested positive, including children. So I guess what advice would you have for them? I know you've said this before, but just as a reminder, what kind of things they should be taking, drinking lots of fluid, vitamins, etc.
Yeah, I think that the simple regimen that they do, really that they can help themselves. Number one is exercise and watch what you eat and keep you healthy. That's number one, right? But other supplement you can take, if you're not allergic to aspirin, you can take a little baby aspirin, 81 milligram, because again, that's the anti-inflammatory effect of the baby aspirin. Zinc, vitamin D, vitamin C, okay, and melatonin. Those are the ones you can buy over the counter. You can take every day. It boosts your immune system, so that way it decreases your risk of getting sick, right? But those are the regimen that you can take, and you can get that anywhere over the counter, and I think it's everywhere that you can access to. But I'll take again. There's no substitute for trying to be healthy with exercise and what do you eat. But if you don't, because the schedule is so busy, then try to take those vitamins again. The baby aspirin, if you're not allergic to aspirin, zinc, vitamin D, vitamin C, and melatonin. Those are the one that you should take every day just to help boost your immune system.
What about if you test positive for COVID? Same thing.
If you test for COVID, usually stay at home, and you can take those things. It will really help you a whole lot.
All right. Right on.
Appreciate your time, Doc.
Thank you so much, Doc. And we salute you and all the frontliners at the clinic.
Yeah, the antiviral pill should be out this week, so hopefully the community provider can start writing for the high-risk patient. Again, they should have a guideline who's a high risk is. And it's not going to go for everybody. Okay, so I know a lot of people say that depending on who you know and who can get it, but no, it's going to go to the highest risk patient that need to take them, because this antiviral pill is not benign. You have to look for the kidney and the liver function test. So the physician will determine who's eligible to get this antiviral agent, okay?
So, Doc, we've had the pill. It's been a couple weeks. At the clinic level, have you had high-risk positives that would have been able to avail of this treatment? And what's the process? Are they just sitting on it? What's the deal?
Yeah, I mean, there's in the past week or so, especially when we don't have the Regenco, we have quite a few high-risk patients that does not have any antiviral agent to take. But again, we just have to follow them very close every day. Just call them and ask them how they're doing, and make sure they're doing okay. And we only inform them that, hey, check your pulse oximeter, make sure that your oxygen is above 93%, and if below 92%, it's time to go to the emergency room.
All right, so there you go. Get that oximeter out, guys. Dust it off if you haven't already, and check yourself. 9:37. Thank you, Doc.
Okay.
Thanks, Doc.
Right on. Dr. Hoa Nguyen, we got to take a break, guys. You good?
Mm-hmm.
Yeah. It's 9:37 Pacific.